We are continuing lesson 2 of respiratory system, and now we're going to talk about the mechanics of breathing. So during inhalation or inspiration, the diaphragm contracts and flattens. So it works with, this is the diaphragm. The diaphragm here, as you breathe in, it will flatten to make room for the expanding lungs. And this works as well with the intercostal muscles, which are attached to the 12 pairs of ribs on both sides of your lungs here. So the 12 pairs of ribs are connected with the muscles called the intercostal muscles, and those muscles will be moving those ribs outwards so that the chest cavity will become larger as you breathe in. So during inhalation or inspiration, the intercostal muscles expand, the diaphragm goes down to make room for the lungs during inspiration. So this is called negative pressure breathing. What that means is it will increase the volume of the air pressure in the alveoli to below the atmospheric pressure, creating a vacuum. So here's, if I were to draw the alveoli here, this alveolus, one air sac, this alveolus then will contain air inside it, so oxygen, and of course there's oxygen in the external air as well, in the external environment. So as you breathe in, the oxygen here will be higher than the oxygen inside the alveolus. So by what happens then is by diffusion from high to low, it will force the air into your lungs, so you'll be forced to take a big gasp of air. When the region of high pressure to a region of low pressure, then the air has no choice but to rush in through the respiratory tract and into the alveoli, and this happens during inhalation. So as we bring in the oxygen, so negative pressure breathing is basically the atmospheric pressure moving into the lungs alveolus because of the high pressure and because there is a low pressure in the lungs. So as you breathe out and empty the lungs, this creates a temporary vacuum. It's not really a vacuum because there's always going to be a little bit of air in the lungs even after a deep breath out. So deep breath in, and you can't really empty your lungs of air. So, but this will be a lower pressure. So the high pressure outside our body will create a negative pressure, meaning that it's sort of a empty, and the air will be forced inwards by diffusion. This negative pressure breathing is what allows us to breathe involuntarily. During expiration or exhalation, it will be the reverse step of the inhalation process. So when the diaphragm relaxes, it will assume the maximum curvature. It will curve up, and there will be little space in your cardiac or the thoracic space. Also, the intercostal muscles will move inwards, and it will basically squeeze the lungs and force the air outwards. So the movements push against the pleura, the chest cavity will decrease in size, and so what happens is the air pressure outside the lungs will rise above that of the external air. So this will force the air out of the lungs during the exhaling of the air. this is what we call the negative pressure breathing. So when you are inhaling, what happens is the volume, the space inside your chest cavity will increase. When the volume increases, this results in pressure decrease. So when the pressure is lower, the movement is, it always goes from high to low. So as you breathe in, when you're breathing in, the volume of your lungs will increase, the pressure will decrease, and the air will go in. It will go inside because the pressure is lower. On the other hand, during expiration, when the air goes outwards, the volume or the space inside your chest cavity will decrease because now it's smaller. Okay, remember your intercostal or rib muscles will go inwards and the diaphragm will go upwards, so leaving less room for the chest cavity. The pressure then will increase. So you see they're opposite. They are completely opposite. And this in chemistry, you learn this using a law, in one of the gas laws. And because the pressure is high inside the lungs, the air will have no choice but to go out. It will be forced out by exhaling. So this would be the relationship between volume and pressure. Here is the volume and pressure are inversely related. So if the volume goes up, the pressure goes down. As you can see, this is kind of like a floor, okay? So when volume goes upstairs, the pressure will go downstairs. They really don't like each other. So it's the reverse. And this is the mechanics of breathing, and it's called negative pressure breathing. We talked about the defense mechanisms of the respiratory system. Amongst those is coughing. This is a reflex, and this is something that is an involuntary response to irritation of the throat, the trachea, the lungs, or the pleural membrane. Sometimes when a person is nervous, it can be voluntary and it can be forced out. Coughing is a rapid contraction of the chest and the diaphragm muscles, causing a sharp intake of air. So when you cough, it actually forces a sharp intake of air, but it also forces some air out of your lungs as well. So that is why when you cough, coughing is actually a pretty fast. So because it forces the air out, it also will force the air in as a result of that. The epiglottis closes as the chest and the diaphragm muscles relax, and this causes a buildup of air pressure inside. And when the pressure is high, it has no choice but to go out. So the epiglottis then will suddenly open and the air blows out, carrying the particles with it. Coughing is actually a very rapid release of air particles from the inside of your lungs, and you're talking something like 100 miles per hour. So when we wear masks, just the act of breathing, you're expelling air, right? By inhalation, you're forcing the air out of your nose and your mouth. And so imagine when you cough or sneeze, it's a rapid release of air that contains all the particles inside your lungs. So wearing the mask during this pandemic actually prevents that rapid release. So it will be trapped by the mask. So really, my mask, I wear my mask to protect you from my particles that come out of my mouth and my nose, and your mask protects me. But if you have a very efficient medical grade mask like the N95, then you're wearing this mask, you're also protecting yourself, not just others when you wear it. Okay, sneezing is another sudden expulsion of air through the nose and the mouth. The irritation of the nasal cavity lining, it simulates the sneezing action, and your brain then will cause this involuntary motion that you sometimes you can control it, but usually you can't. During a sneeze, the heart stops momentarily and breathing is interrupted. So you can't, it's quite interesting to note that when you sneeze, the heart stops momentarily and you stop breathing as well. Hiccup is basically a stimulating vagus nerve. So vagus nerve is part of your spinal cord and it relates it to the diaphragm. So the contraction of the diaphragm forces the air rapidly out of the lungs, and the sudden closing of the epiglottis as the air is drawn into the chest produces the sound. So when the diaphragm rapidly contracts, the epiglottis is drawn into the chest, and that is what you hear when you produce that hiccup sound. Hiccup can be caused by eating too fast, drinking too much alcohol, and by irritating disease of the digestive system, heart, and lungs. Yawning. You've ever heard that yawning is contagious? Yawning is a combination of psychological and physical reaction, and it's an involuntary stretching of the mouth with a large intake of air. So it could be because of a decrease in breathing when you're tired, bored, or if there's a drug action and the body needs more oxygen. So it forces it to suddenly intake that air. And when you open your mouth wide, I'm yawning. It actually is just thinking about yawning. Again, it's a psychological and physical reaction. So when you see someone yawn, because they're tired or bored or there's a drug action in their body, you may actually want to yawn as well to increase your oxygen in your brain. Snoring is a result of vibration of the soft palate in the mouth while sleeping. This could also be caused by your adenoids as well being enlarged, and also some blockage of the nasal passage or the nasopharynx. So it could be a cartilage that is blocking it. It could be just the nasal passage. There could be a bone or a cartilage that is blocking that breathing, and it could cause snoring. And it could be just the shape of the jaw as well. And as you sleep, it may not be lined up, and it can be corrected with some dental appliance as well. Now, okay, now we talk about lung capacity. So lung capacity. So some terms that we need to know about the capacity of your lungs to hold air in. One is called the vital capacity. This is the maximum amount of air a person can forcibly exhale after the largest possible inhalation of air. So you take a deep breath in and then you exhale until you feel that you've emptied your lungs of air, although there's always going to be some leftover air in your lungs even after you exhale it. That is what we call the vital capacity. So vital capacity really is the sum of the tidal volume, the inspiratory reserve volume, and the expiratory reserve volume. So these combined is the vital capacity. All these measure of air in your lungs is the vital capacity. Well, the tidal volume is the amount of air that is inhaled or exhaled during a normal, quiet breathing. So as you're breathing in, that is the amount of air that can be inhaled and exhaled, which is about the same. The inspiratory reserve volume is the amount of air that can be forcefully inhaled. So you take a normal inhalation and you force your air out of your lungs. That's the inspiratory reserve volume. The expiratory reserve volume is the amount of air that can be forcibly exhaled after normal exhalation. So this is inhaled, the inspiratory. Expiratory is what you can forcefully exhale. So you take one, just a normal breathing, what you can forcefully inhale after a normal, whatever you can inhale after you breathe in some air. And this one is what you can forcibly exhale after you've already breathed out. And that brings us to the end of lesson 2 and some questions that I'm going to post in Google Classroom that you can answer directly using your Chromebooks.